depressing working with dying people? Depends on your frame of reference. I believe if all there was this life in this body, and when the body dies, it's all over. I think if that's your belief system, then the death of the body, the end of everything that there is, would be very sad and very depressing, and it'd be very difficult to reconcile. And if your frame of reference, on the other hand, is that there's more to life than living in this body, if, for example, there's a soul body and a soul aspect that never dies, then it's not as depressing. The medical director's job is to take care of the physical body. So you're the doctor for the physical body. You're a body mechanic. If somebody's in pain and there's some medication that could be given to them to stop the pain, if somebody's agitated, if they're anxious, if they're depressed, we often have some form of relief for those symptoms. And so the medical director's job is to manage the symptoms that come up at the end of life, and that often entails talking with the nurses about initiating this or that medical treatment for alleviating symptoms. So if that's all there was to it, being a body mechanic, it wouldn't be much fun. It'd be kind of mundane and prosaic and a little bit boring. On the other hand, people that are dying also have an emotional body, they have a mental body, and they have a spiritual body. And all of those bodies need some sort of adjustment, often balancing, maybe. And so if there's an opportunity to talk with people, help them with their fears, their emotions, their sadness, their difficulties, in any of these other realms, that's really where the action is in terms of job satisfaction. It's okay to help people with pain, and that's our number one job as a hospice physician. But there's also often an opportunity to sit and talk with people, to share with them, find out what's worrying them. And if there's been a patient who came before them, who taught me something about how to manage that symptom, then I might be able to pass that on to the patient in front of me and help them on their journey.